guys, let's talk about abdominal scars and abdominoplasty. So one of the key factors for wound healing is good blood supply, and previous incisions and scars can affect blood supply. When I was a resident, the main scar that we always were taught was the open cholecystectomy scar. So it's like a big chevron incision in the upper abdomen. And the traditional teaching was that you really shouldn't do an abdominoplasty because you could have compromised blood supply to the skin. Since then, I've learned, and we as a specialty have learned, that if the open cholecystectomy scar is very, very old, then generally you're going to do fine with blood supply. You also have the option of putting a vertical scar like a fleur-de-lis abdominoplasty, which is going to remove a lot of the upper abdominal laxity in a way that preserves more robust blood supply as opposed to some of the more tenuous blood supply that may have been affected by the scar. So open cholecystectomy scars are not necessarily an issue. I had a patient comment on another post asking about a diaphragmatic hernia scar, which is going to be a similar spot. And my suspicions are a vertical incision would be a good option for there as well. I do sometimes do a reverse abdominoplasty where the scar is up under the inframammary crease, but that really only works if the laxity is above the belly button. So if it's not, then you may be looking more at a vertical skin excision with a little bit of horizontal. The fleur-de-lis tends to be a great option. Other scars that I have run into blood supply trouble, ostomy scars, they're only small, but they tend to be right in the middle of the abdomen. So when you pull down the skin, you can end up with like this one little strip of healthy skin between the abdominoplasty incision and the ostomy scar. And that skin doesn't get good blood supply. So I've run into issues there where a patient had a scar like that and the skin necrosed and then it healed it. So depending on where that scar is, we might tweak things or just know that it could be problematic. Your small scars from anything laparoscopic, cholecystectomy, tubal ligation, appendectomy, those are not going to be issues in terms of blood supply. Open appendectomy scar is low enough down that it generally comes off with the abdominoplasty specimen. As I've mentioned, C-section scars also come off with the abdominoplasty specimen. So those are kind of the main ones. And then any sort of vertical midline scar from a laparotomy isn't going to affect blood supply because blood supply comes in laterally. Sometimes I'll use that and add that fleur-de-lis excision because the scar's already there. So I'll take the tension off and take advantage of that scar. So if you have prior abdominal surgeries, be aware we may need to tweak things, but that's definitely something we can do.